Thank you very much. It is a great pleasure to be able to have this discussion with you on the greater achievements of His Excellency President Paul Biya. As you well know, we're coming out of a long economic recession, and we did a health sector review, and in 2001 we were vaccinating only at 43% for the diphtheria, tetanus, and whooping cough antigens. Today, as I talk to you, we have moved from this 43% to an 80% coverage of vaccination. This in spite of our population growth. As far as infrastructural changes over the last several years, there has been a great momentum towards bringing healthcare of good quality closer to the population. You will remember after the 2004 presidential elections, there was an engagement by the head of state that says that as long as a Cameroonian will not eat to their fill and get the health care that they deserve, his job would not have finished. And in this regard, he promised to build many health centers over the country, and I can tell you that in the last 3 years alone, we have received 133 health centers, and in this last year, about 20 to 30 of them, others will be commissioned. We have had several hospitals built, and there is a big extensive program of coverage for curative medicine. For instance, we used to have one regional hospital per region, but today we have annexes to the regions. There's an annex regional hospital in Yagua, there is one in Boya, there is one in Kongsamba, there is one being built in Edea, and there is a big hospital project in Sangmalima. When you have infrastructure and equipment, you need to have the human resources that will operate this equipment, that will make sure that these infrastructures indeed serve the population. In this regard, the head of state has over the last several years commissioned the recruitment of personnel of all categories and all specialties into the public civil service. As I speak with you, last weekend we just had the entrance examination into the public service to recruit a total of 3,500 personnel in health. The year before, I want to remind you that the first 600, the first 1,200 and subsequent 600 highly indebted program initiative staff that were recruited on contract into the Ministry of Health were formally integrated into the civil service. Now, so we've looked at infrastructural development, we've looked at human resource planning and programming with recruitment, but what is even more important is that, as the President said in December 31st, 2007, we must look for a way to assist the needy and the poor. And he called this assistance medical, medical assistance. This indeed comes in the chapter of financial access to health care. What has been going on is that The access to care has several factors. In our provision of health care to the population, instructions were given such that, for instance, patients who have HIV/AIDS, who need treatment, have free medication. They have subsidized services such as tests for the HIV/AIDS, so that anyone who needs to know their serologic status pays only 500 francs. Whereas pregnant women and newborns, that is, have free testing